Radiotherapy is a very important treatment modality in the treatment of cancer.
In radiotherapy, we are firing beams of radiation into the patient. What we do is we try to identify the directions to aim those beams to avoid healthy tissue, but maximising the dose to the tumour.
There are two types of radiographer. There is a therapy radiographer, which uses ionising radiation to treat disease. Patients are coming for up to 7 weeks of treatment, so the radiographers on the treatment machine get to know the patients very well. And there's a diagnostic radiographer that uses ionising radiation to diagnose disease. Being a therapy radiographer is a technical job, and working in radiotherapy involves a whole multidisciplinary team. The other people who are important in the team are the doctors, so the clinical oncologists, and the physicists.
The physicist tends to work alongside a clinician. The clinician will prescribe the radiation dose that they want the tumour volume to get. The physicist will work with them to ensure that the correct dose is delivered to the tumour volume, but not to the healthy tissue surrounding it.
To be a therapy radiographer, you definitely need to have a caring nature, because you will see all types of patients, so you need to be able to empathise with those patients and offer the right emotional support during the treatment. There's two entry routes into radiography. You can go to the undergraduate, the Bachelor of Science. There is another route you can take, and that's a postgraduate degree course, and that's for anyone who already has a science degree. And then you can do a fast track, that's only a 2-year route.
The kind of characteristics you need to work in radiotherapy physics is a good scientific mind, very methodical, precise, but also because you're working with patients, you need that softer side, that softer touch as well. You'll need a physics degree or a degree in physical sciences. You will then go through a training scheme which will include a master's degree and includes training within the radiotherapy setting.
I'm really excited about the delivery of proton beam therapy because it's the first in England, and it's an absolute privilege to be part of the project. Proton beam therapy is just a branch of radiotherapy, so to get into it you'll just go through the regular route to get into radiotherapy, whether that's as a clinical oncologist, a radiographer or a physicist.
If you want to enter into proton therapy physics, the route will be the same as standard radiotherapy physics, but then you'll specialise in proton therapy at one of the two centres.
It's essential that the proton beam therapy is delivered in institutions like the Christie and UCLH with a very established radiotherapy service. What you enjoy about the job in a typical day as a radiographer is the patients. The patients really appreciate what you do for them, and it's that sense of appreciation, that sense you've made a difference.
We know we can cure the patients, so when we produce their treatment plan and we see them walk out at the end of their treatment, we know we've done good for them.
Over the last 20 years, I've got a lot out of the profession. It's given me a lot, and I've thoroughly enjoyed it.